Healthcare is changing rapidly with new technologies like telemedicine and virtual visits, and this means there are lots of new ways for patients to consume healthcare services and interact without necessarily going to a physician's office or a hospital. It also means that there's new opportunities for medical coders to tackle these increasingly complicated medical records and legislation. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, I highly encourage you to subscribe and hit that notification bell so you can get alerts when I post new episodes. Also, if you're still researching and looking into this as a potential career for yourself, make sure you stay through the video because I am going to give some recommendations on where to get started and some school recommendations as well. But let's start here. Medical coding is the process of converting medical records, all the procedures, diagnoses, services, equipment, into code sets so that they can be used for billing purposes as well as administrative purposes as well. Patient tracking, data tracking, tracking the diseases and the outcomes. The demand for highly skilled medical coders has increased over the years because of all the different complex regulations, all of the different complexities going on in healthcare technologies, all of the different needs that we have for that data, for knowing how many patients have a certain condition, their progression of the disease, not to mention the increased need to share all of that data in a very uniform way across providers and healthcare organizations. And regardless if you're new here, if you've been in the industry for 20, 30 years, you're going to hear a lot about AI in medical coding. You may even hear people say that AI is going to completely replace medical coders, but I can assure you that I've been in this industry for over a decade and we've had AI for over a decade, and the increased need for medical coders has just continued. I myself even use some different artificial intelligence tools in my business. So AI is not going to replace medical coders, but it is going to transform the way that we work progressively through the years. For example, I was recently watching the news and learned about these new robots that were developed that they can take food from people in the kitchen to hotel guests in their room. It was developed because of staffing shortages, and now it leaves the existing staff that is there to concentrate on more value-added things like taking care of customer service issues or coordinating activities for guests. You've probably even seen some robots working in your grocery store. There's even ones now actually in the hospital, but they don't replace nurses. They shift their focus so that they can stay with patients. So there's a robot I recently learned about called Moxie, where it basically can take prescription medications from the pharmacy that were ordered and take them up to the patient's room, which leaves nurses free to more value-added tasks, things like bedside care. It's a poor use of clinical staff time to have them running back and forth for patient medications. So this hasn't replaced nurses, but it has shifted the focus of their job so they can work on tasks that are more things that they would rather be doing, like taking care of patients. And because of a lot of things going on in the world, in the nation, and even some generational things that we're tackling, there's a lot more consumption of healthcare services. And in general, lifespans have increased, which means we're seeing more elderly, frail patients with lots of complex conditions, and they typically have Medicare, which has more complex coverage policies. So right now in most healthcare organizations, providers will select what they think is an approximate diagnosis, or they might put a placeholder like, hey, I did a service, I need you to figure out the correct code for it, because providers really don't want to waste their time picking out codes and selecting codes. They'd rather leave that to the experts, much in the same way that I don't like to do my own taxes. I hire an accountant. I could do them myself, but I'd rather work on other stuff. Much like nurses have more value-added tasks than running medications back and forth, doctors have better things they can be doing than picking their own codes. But coders, we like to do the codes. Coders are responsible for making sure that patients have the right procedure codes, right diagnosis codes attached based off of what was documented in their medical record. Taking all of that medical information and translating it into the right uniform code set can help with our data tracking and also making sure that the information is given compliantly and correctly to insurances so that they can process it for billing and payment. Even with all of these tools that can assist us with code selection, there is still a tremendous amount of fraud. Some of it is very intentional, some of it's just oversights, and some they just don't understand the regulations. And guess who it is who's doing reviews and possibly even going into court cases to be an expert witness in these fraud scenarios? medical coders. I actually have a handful of coding friends that worked with an organization that was hit with a huge fraud suit. The particular surgeon involved had been told by multiple consultants that he was tweaking his documentation in such a way that he was trying to support unbundling it with a modifier 59. Those codes should not have been billed separately. One was included in the other, meaning that payment was included in the other code. So both of them should not have been billed. It was raising up the price and he was getting a lot more reimbursement that he wasn't entitled to. And he did get paid on them for a long period of time until the insurance caught on and they had to pay back $11.25 million, and the particular surgeon had to personally pay back $1.25 million. So the demand for medical coders is going to continue to grow because of all of these different factors, as well as there's still a lot of population that has been in this industry for a long time. They're starting to retire, and that means that there's new coders that need to come in. Now, if you're just starting out and you need some direction on where to get your medical coding education, I would highly recommend onlinedegree.com. Onlinedegree.com helps pair students with the right online education program in medical billing and coding for them based off of their location, their needs, their budget. They're perfect for anyone who is just starting out but really just doesn't know what program's going to work in their schedule. They'll hook you up with a school that can prepare you for the AAPC or AHIMA certifications, and they'll get your training done quickly and save you some dough. You can actually save 10% if you use my link, go.onlinedegree.com/contempo. I will also link it in the comments below so that you can get started on your journey into medical coding today. Medical coders can work anywhere from small physician offices to hospitals, large healthcare organizations, insurance companies. I've seen some coders that work with lawyers, and they can work on site or remote. Once you get out there, you get into the revenue cycle, you get your feet wet, and you have a couple years of experience on you, there is an insane amount of opportunity and job security. Once you get into healthcare and the revenue cycle, get your feet wet, get certified, you will have an insane amount of career opportunities and even job security. If you're interested in learning more about medical coding as a career, like the different salary ranges, job opportunities, this is the playlist you want to check out. I will see you guys in the next video. And until then, just keep on coding on.